does liver cirrhosis evolve? If you could please elaborate on that, so that I'm asking you this question, so that someone who is drinking heavily can be aware of this. There are a lot of families of people who are addicted, who have become addicted to alcohol, who are listening to us, watching us, and also people who might be still drinking or using, or their friends and family. So for them to understand, like, what is, so that they can approach it in the right time, at the right time, to help their loved ones seek help at the right time. So, doctor, how does liver cirrhosis evolve? If you could elaborate on that, please.
So the initial stage, Sujata, is what is called a fatty liver or just enlargement. The beginning of liver damage occurs with fat infiltrating into the liver. The liver becomes enlarged and pushes down into the abdomen, and that is a stage where things can be reversed. That's called the initial stage of fatty liver or alcoholic fatty liver. Often these patients are also obese, they may be having diabetes, and then you get another addition of fatty liver due to that coming in. So often the
Right.
damage is due to multifactorial reasons.
Hmm.
Fatty liver will occur in about 30% of patients who are drinking heavily, and overall liver damage initially can occur even with a small drink. So this whole thing of what we call social drinking, or I drink only at weekends, if you do
Hmm.
your liver function test the next morning after even a single drink, your tests like GGTP or SGOT,
Hmm.
SGPT can
Hmm.
show changes. So
Right.
about 30% of patients with fatty liver then will go on to another condition, which is where the liver gets inflamed, and that is called steatohepatitis. Whenever we say medically itis, it simply means that there is inflammation or more swelling, and the swelling is of
Right.
an inflammatory type, not just due to a bland swelling due to the fat. So just
Hmm.
like tonsillitis or appendicitis, same way
Hmm.
it is due to that,
Hmm.
due to inflammation occurring. But when you
Hmm.
reach that stage, you will thank you, Pankaj, for your kind comments. When you reach that stage, you are already tipping into the irreversible zone, which can come on. But if you stop here, again the
Hmm.
chances are good. There are good chances that you will recover. Almost 60 to 70% patients can recover, or may get into a stage where the liver will not really trouble them.
Right.
The liver is a unique organ, Sujata. It has
Yes.
this tremendous capacity to take insult. So
Hmm.
almost 70-80% of the liver can be damaged, and still there can be no outward signs or overt signs of damage.
Hmm.
And then you come to the last stage where the liver starts getting harder and thickened and fibrotic, and that's what we
Hmm.
call cirrhosis.
Right.
Scirrhus in Latin simply means hardening. So once that
Hmm.
hardening starts occurring, then you have reached a point of no return. You are gone into what is called a stage 4 fibrosis, from where your
Hmm.
liver can only go downhill.
Right.
Still there is an opportunity, still there is a window of opportunity here too, that if you stop
Yes.
alcohol totally and take care of your other factors, your obesity, your diabetes, other factors, you might still not go into get tipped into what is called decompensation. So you will remain in a stage of compensated cirrhosis. And as I told you,
Hmm.
the liver is a great organ, so it will still manage. Even with all that happening, it will still manage.
Right.
But you continue to drink after that, and then all hell breaks loose, and then you'll end up with all the complications. One of them was portal hypertension. You can get into bad jaundice, you can start getting infections, you can start getting affection of the brain, which is called encephalopathy, and so on
Right.
and so forth. And the kidneys can get
Right.
affected, heart can get affected, so you get what is called a multi-organ dysfunction coming on as the liver gets, you go into what is called decompensated cirrhosis.